Hey guys, it's Dr. Rachel here. And yeah, so I thought we would do something um, really cool today. I want to start sharing some patient case studies with you. And the really cool thing, as you'll see with today's case, is that how this patient heals in so many ways, but you'll see the progression of the healing process, like each time we go to reevaluate the patient. So, what I'm going to do is try to share my screen here. And let's see if we can get to that option. Um, all right. Hang tough here. Okay. So unfortunately, I'm streaming from the iPad. It doesn't look like it's going to let me share some x-rays, which I really wanted to do. Um, but I wanted to share something really cool about this patient. So this is a case of a 25-year-old male, and he presented to our office with lower back pain. Really common, we see that a lot, but it's interesting as to because each case has a different cause or potentially different cause of low back pain. This patient had been suffering with back pain for a little over a year. It had been off and on, but then all of a sudden it started to become a lot more frequent and a lot more intense. And it got to the point where he was having pain at least 3 days a week. He's not really sure what he did to cause the back pain. He said he does play lots of basketball, and he does unfortunately have a desk job that makes him sit. And we know that definitely can put a lot of pressure in the back several hours a day. He had been to his PCM. They did an exam and actually ordered him an MRI. Didn't really find anything significant there. He'd done some stretching, and he'd also taken some Motrin. He had been taking Motrin, and he was just getting really discouraged because he's only 25 and he's having a lot of issues with his back. And he said that most of the pain was along his waistband area. He had got a lot of pressure in there. Felt like there was just like he was wearing a backpack constantly. It got very difficult for him at times to be able to stand for long periods, and he would actually eventually have to sit down and stop what he was doing, and it would kind of take his breath away, so he would have difficulty breathing. And he rated his pain as a 7 out of 10, 10 being the worst pain a patient can stand. He put his at a 7. The biggest issues he was having was that it was preventing him from doing like long-term exercise. So he was in the military. He couldn't get his mile-and-a-half run in that he needed to pass his PT test. He was really stuck at that mile mark. He couldn't run any further than that because of his back pain. And then also when he was doing sit-ups, he started getting a lot of popping and grinding in his back, and it would actually worsen the pain. So he was getting to the point where he couldn't do sit-ups. And his biggest concern is that he was not able, like he failed his previous PT test, and he realized that, in order to keep his career, he was going to have to, get this corrected. Unfortunately, the things that he'd already tried, like his primary care doctor, stretching and the Motrin, weren't fixing it. So he came to see us. And so when we did the exam on him, and we do a really good exam, that's one of the things that I pride ourselves in, is if you don't do a really good exam, you can never figure out the cause of the patient's problem. So we did an exam. Definitely found, confirmed that the lower back pain complaints were coming from his back. But he also had, on the exam, we revealed that he had sinus issues, mainly like recurring sinus infections and a lot of allergies. He also suffered from migraine headaches, neck pain, upper back pain, acid reflux, and bowel issues. And the bowel issues he was having was mostly that of constipation. So, I was hoping I was going to be able to show you the x-rays. Unfortunately, the software is not that I'm using right now isn't compatible from this iPad, so I'll make sure that I'll be able to do that with the case studies moving forward. So we found all those other issues he was having, like those were revealed on the physical exam that we did. So based on the physical exam, I took some x-rays. So we took one from the front, one from the side, and then also put one of the things that we do that's pretty unique is we actually take x-rays of the patient moving, so we can see exactly, like, he gets pain with running, he gets pain with doing sit-ups, like when he's in movement. So we wanted to see what, where his spine was actually shutting down, or there was potential problems with him actually moving. And so when we did we looked at the x-rays, I was able to find that he had multiple misalignments in his spine. And so we call those subluxations, but essentially what that is, what was going on with him is, like, in your spine, all the way through your spine, especially in your lower back, one of those bones or one vertebrae should stack on top of each other like this. And as long as that is the case, all the nerves in that area and there's no issues. But he had several that were twisted and shifted out of position. So it was strangling the nerves in that area, and that part of his nervous system. And of course, those nerves went to his back. So that was confirmed on the x-ray, and we were able to see exactly where things were shutting down when he was in movement. And then the other thing too is because, when you're working with the spine, you can't just, and I learned this the hard way over years of practice, you can't just isolate the patient's condition. You have to look at it as like the whole patient, the whole body. So even when we have a low back pain patient like this guy, and we can confirm where his lower back pain from, because we did a really good exam, we could see that he had neck pain, upper back pain, bowel issues, acid reflux, migraine headaches, like all the stuff, right? And we see this a lot with patients. And so when we did the exam, we realized that he had several subluxations throughout the rest of his spine as well that was actually causing some of the other issues that he was having. And so just real quick, I'll just keep this really short. I won't keep you long, but the spine, and this is the foundation of what we do as chiropractors, is the spine controls everything in the body. Like if you just right now just Google nerve system chart, and you'll see this beautiful picture of a spine with all the nerves that come out of every level of the spine, and you'll see that it literally plugs in to every cell, tissue, and organ that you have. And so the cool thing is based on what I could tell from his exam and x-rays, I needed to treat him for a few months. And so one of the things that I always like to do is I don't like to base the patient's progress just on their symptoms, even though I always love it when a patient starts to feel better. I want to make sure that there are ways that we can measure their progress. And so we got to the first re-exam, which we do these every single month in the office to make sure the patient is progressing, and he was no different. And I'm reviewing his chart right here. So at the end of month 1, what we noticed was that he hadn't had a headache. He hadn't had one of those migraines since he started care. His neck was feeling a lot better. Also, he hadn't had any episodes of acid reflux in the first month, or after the first month of care. So that was pretty amazing. The other thing is, so we switched things up because he was ready. We don't keep doing the same thing to patients even when they're healing. We'll start to switch things up so the patient gets stronger. In other words, we're moving to a long-term resolution, not just a quick fix. So once we got to month 2, and I'm reviewing those notes here, his lower back pain started to get significantly better. He was able to run a mile. He could do the sit-ups. He said that he could do them, but he could do them pain-free, but he was still getting the popping. So it's progress, but there's still some healing left. And he was able to maintain, being migraine-free, not having any more episodes of acid reflux. His upper back pain was going away, and now his bowel issues were starting to clear. So he said he hadn't, at least by the time we'd gotten to this point, it had been about 2 weeks since he had had any constipation episodes. Now, so we treated him. We continued to finish his care plan or his treatment plan. Now, at this point, we're changing things up again. He's not seeing me as often. And now, since we're starting to correct a lot of those subluxations, we really want to focus, and the symptoms are resolving. Now we're starting to focus on strengthening the areas around where there were spinal problems, because what we don't want is to keep going back to the same conditions that he came in here with, because if we didn't, that will happen if we don't strengthen the area around the spine so we can get a lasting result. So once we got into the final re-exam, approximately one month after the second one, what I noticed is that the lower back was doing great. There was no more popping and clicking and no more pain. Occasionally, if he really pushed himself, like at the gym, he would get some soreness, but that's pretty normal. He was still migraine free. He still had no more acid reflux. And the upper back pain had cleared. The bowel issues had cleared. And now he was starting to notice that even though he had some stuffiness in his sinuses, he wasn't getting those recurring sinus infections. And he definitely said he could breathe a lot easier, especially at night. So, when he was sleeping, he wasn't getting the snoring as much. So this is really amazing. It's amazing the power that the body has to heal, as long as you are able to correctly determine where the cause of the patient's health problems are coming from. And so what I was hoping to be able to do, which I'll make sure we can make happen next time, is that I can show you, like in this case where a patient has lower back pain, I can show you a healthy low back on an x-ray. And then I will show you the patient's low back, and then I'll circle the areas where they had the symptoms. And then we do take new x-rays at the end of the patient's treatment plan, however long that is, so that way we can put the x-rays side by side. And in addition to making sure that the patient's symptoms are resolving, we want to make sure that we can actually see the correction on the x-ray also. So now we can, being a physician, making sure that at least for my sake, for the patients too, that we got a lasting correction here. And it's not something that's going to keep trying to go back to square one, as soon as we let off. And a lot of times patients will say, like, what happens if this stuff comes back? What if I just stop doing anything for my spine? And so we don't let you do that. Of course, you're the patient. You can do whatever you want to with your care here. Our job is to tell you the very best thing for you to do. And then, of course, the patient can share with us what they want. But we always recommend maintenance after we go through this. The coolest thing about maintenance is with a lot less time, effort, and energy, and seeing us way less often, you can actually maintain the same results as long as you're just doing some of the basic homework that we give you at home, mainly with the strengthening and the stretching to make sure that you're continuing to stabilize those injured areas. Because if you can imagine, if somebody's suffering, this guy just had low back pain for a little over a year, but some of our patients have had back pain for 20 plus years. And so, or they've had whatever their main symptom is for that long. And so we just want to make sure that, you have to understand it's going to take a bit longer to heal. And so it just makes like the homework that we give you, mind you, we try to keep it really simple. Like it shouldn't take any longer than a couple minutes to do the home rehab exercises that we give you. But just because it doesn't take long doesn't mean that it's not important. So we've got to make sure that you stick to it. So this is really cool. This was a classic case of what we see, patients coming in for back pain or some type of pain related issue. And then lo and behold, when we do a really good exam, not only do we find the cause of that, of their complaint, but the exam reveals other health issues that they're having. And because the spine controls everything, once you start to get that thing healthy and functioning properly again, then the patient just really heals well from just about everything. So super cool. If you guys have any questions at all, post them here. I'd love to help you out, even if it's just something that I can help with you just here asking questions. But yeah, we're going to keep posting these every single week, and I look forward to being able to share them with you. All right, we'll catch you guys later.